Agnes Ochilo. I'm spouse to the governor of Migori County. I'm also the deputy chair of County First Ladies Association of Kenya, and I'm also a patron in some secondary schools within my county. I am also the founder and CEO of Mama Agnes Ochilo Foundation. This is a foundation I formed because of the needs that I saw in the community. Being a politician's wife, during the campaigns, you are able to walk around the counties, talk to different people, and experience the challenges that they go through. So when my husband was elected governor last year in August, I sat down and I noted that the office, having become the First Lady of Migori County, I also noted that the office of the First Lady is not funded. The First Lady is not an employee of the county, yet there are responsibilities or demands that are put on your life, to assist the community. So that's when I came up with the idea of the Mama Agnes Ochilo Foundation. I did the official registration. It is a registered foundation with the requisite documentations that are required, and it meets all the requirements of a society that is registered within Kenya. From that period when I formed it because I still needed to find ways of assisting my community, and I needed to talk to people, like-minded organizations or individuals who could assist me to get funding and to have the opportunity to assist the people within the community. Ever since the association was, the foundation was formed, I have done quite a bit. I've been able to attract a lot of funding. I've been able to speak in forums about my county and about the foundation. And if I may just pick a few of the successes of the foundation, number one, I'll start with the funding that we got from Equity Bank. The Equity Bank Foundation gave us non-pharmaceuticals, which were worth 7.3 million Kenya shillings, and we were able to distribute this to all the sub-county health centers and medical facilities within the county. And this really helped a lot because it is at that time when the county government was still trying to identify funding and have the budget released to them. So it came in handy and really assisted our people who were unwell. We also had a function, or we had a partnership with M-Pesa Foundation and the Flying Doctors. They came and assisted us do corrective surgeries for the fistula mothers. Migori, the rates of non-skilled deliveries are high. We have FGM, we have early child marriages, we have early marriages, we have factors that contribute to fistula conditions. So when they came, they really assisted us. We were able to undertake corrective measures for over 90 women. And I'm glad that some of them up to date still come back to me just to appreciate what happened. They appreciate that now they are able to carry out their duties within the home as a mother, because before they had to keep hiding away. When there are guests in the house, they move away because they could not contain, the visitors could not contain the smell, they could not sit where they were. So I've had a lot of encouraging messages that make me look forward and ensure that I'm able to do a lot. And then we also had a partnership with Matibabu Foundation. Matibabu Foundation gave us scrubs for about 1,500 workers within the Migori County. And this one was to focus on cancer screening and cancer treatments. And with this, we were able to encourage our staff to go out and look for the patients, to go out and encourage mothers to ensure that they do cervical cancer screening, to ensure that their children are vaccinated against cervical cancer, the HPV virus. And we were also able to get them, the ones who had the lesions, they were able to get some treatment. In addition to that, the scrubs have made us now outstand. We are outstanding in the country. In the last statistics, in the last research that was carried out and the statistics that are available, Migori was placed as the best performing in the entire country in cancer screening. We had exceeded our target by 94%. So that means we are currently at 194%, and I contribute this to the Matibabu scrubs, which made it more made us more visible even to the patients, because our scrubs are written eradicate cervical cancer, and when we wear these scrubs, people are able to remember that they should go for screening. In addition, Migori County is also affected by sickle cell. We are a county that we are one of the countries that are found along the lakes, and so that means that malaria is rampant within the county, and this has led to sickle cell, especially amongst our populations that are next to the lake. And I realized that a lot of the people within the county contribute sickle cell to witchcraft, and there are myths that surround sickle cell. And having met women or other people who have encountered sickle cell, I came to realize that sickle cell is a condition that can be managed in different ways. One of the first people I consulted was the former First Lady of Bungoma County, Mrs. Wangamati, and she introduced me to Sickle Cell Foundation, the Children's Sickle Cell Foundation in Nairobi. I spoke with them. I got to meet warriors. I got to meet people who have fought sickle cell. And I realized that even in my county, we can still make a difference. They got in touch with German Foundation, the German doctors, and we were able to set up a clinic within Rongo sub-county. And what has made me so excited about this clinic is that now we have, our people can openly talk about sickle cell. It is no longer witchcraft, it is no longer a curse. They've realized that it's a normal disease that if managed well, then the children can grow up to be adults. Because when I first spoke to even the medical providers within the county, they were referring to it as the disease of the children. But now they appreciate that if the children are taken care of well, if they are managed well, if they are on medication, then they can grow up to be adults just like the others. Because my function cuts across, I also got in partnership with the Lap Fund Foundation. Lap Fund Foundation were able to give me cash directly, and I managed to purchase seats for the ECD's children. We were able to distribute this to the schools around Migori County. Some of the schools were so pathetic, you would go and find children sitting on stones, but with the seats the chairs that were given to us through Lap Fund Foundation, we were able to give them seats, and they really appreciate. One of the other successes that I can talk about is AMREF Africa. In partnership with AMREF Africa, they were able to give us a mobile clinic that was able to reach the far-flung areas within Migori County. Migori County is quite wide, and we find that there are places that are very far from the dispensary or the health centers that we have. They gave us the clinic for 4 months, and within that 4 months, we were able to reach all the sub-counties, all the wards within Migori County. And from my experience and from having talked to the mothers, they were very excited because they were able to have a one-stop clinic that was able to address all their diseases. We were able to undertake screenings for various diseases. We were able to treat the minor diseases like malaria. We were able to even check on their vitals to find out how they are. And all the cases that were found to be wanting were referred to various clinic facilities to assist them get well. As you all know, also Migori County, we have FGM. We have a small population that still practices FGM. It's not small really, but it is a third of the population of Kenya. This is our Kuria sisters and brothers. They still practice to some extent female genital mutilation, and this is something that we've been trying to fight, because much as we appreciate our culture, there's cultures that are also harmful to our children. And I got to speak to my counterpart in Marsabit, Her Excellency Alamitu Jatani, and I found out that she has been holding programs within the counties to just educate the girls, to let them know the effects of the FGM, to also talk to the parents and the community to agree to stop FGM. And having seen the successes and visited her earlier this year, I managed to put up a program that was supported by several partners, including the county government of Migori, World Vision, and several other partners. We put up together Kambi ya Wasichana, which is an equivalent of what they're having in Marsabit. And we were able to bring together 200 girls aged between 8 to 12 years. They were taken through a 3-day training where they were told about the harmful effects of FGM. They were also made to appreciate education. And we also brought in the parents, and we showed the parents what the girls go through during the circumcision process. And together as a community, we agreed that we are going to stop FGM. We are yet to get the statistics, because December is our month, is the month when the most of the FGMs are undertaken. And I believe that that training or that camp that we undertook is really, really going to assist us eradicate this. Eradicate FGM, so that our children can be free to grow up normally and be able to have their families in a proper way. As I look at what the foundation has achieved so far, I still realize that we are still short of meeting our targets. We are short of meeting our objectives. And I want to call upon all the like-minded partners who are able to assist us address some of the social challenges, some of the health challenges, some of the education challenges that we have within the county, so that the people and the children of Migori can also grow up with in the right environment, in a healthy environment, and they can enjoy all their human rights.